So the Future of Nursing report is over a 500-page report, has over 9 recommendations, and the vision for the report is the achievement of health equity in the U.S. that's built on strengthening the nursing capacity as well as the expertise of nursing. There was an expert committee that kind of highlighted areas that nursing was going to face and we needed to face in this decade. And part of that, it was as a nursing workforce that we have a need to reduce health disparities and promote equity for all. Other thing is like we have to kind of look at the rising costs through more equitable care delivery. And we also have to need to look at the use of technology to reach vulnerable populations. That's really in our space. And then we have to place a priority of patient and family focused care. Now, patient and family focused care is like an informed care, a shared decision care, patient-centric care, right? It's a call to action. This report says, hey, this is what we need to do. We're moving forward. Health equity is the attainment of the highest level of health for all people. It's achieving health equity. It requires valuing everyone equally. And to achieve health equity requires removing obstacles to health. And to remove them, that means we must know about them. And if we to know about them, then we need to ask about them. We need to screen. We need to assess. So the reason we need to do this as well, because these questions and understanding the patient story, they could include things like poverty, lack of access to good jobs, fair pay, quality education and housing, safe environments, and healthcare. And all these things lead itself to optimizing. So in 2023, the IPPS final rule with CMS, which is your Center for Medicare and Medicaid Services. And just for a show of hands, how many of you within your Informaticist role help with the promoting interoperability of your space? Awesome. And that is part of my role as well. In this space, we have right now the IPPS rule that says for the inpatient quality reporting program that we're going to have to submit 2 brand new measures. One of them is SDoH 1 and SDoH 2. And these measures in 2023 are voluntary, but they're required and mandated in 2024. There are 2 measures. Again, SDoH 1 says you need to screen for the social drivers of health. SDoH 2 says screen positive rate for social drivers of health. They're both structural measures. They have specific patient populations that are associated with them. They have a lot of specification with them. So in the essence, the first measure wants to know how many patients that you screened, and the second wants to know of those that you screened, how many were screened positive. Now, from a health equity standpoint, I'm going to tell you in the literature, it is not ethical to just screen patients and then not do anything about it. So from an operational standpoint, you really need to work with your organizations, your facilities, say, okay, we're going to do this because the government's telling us we have to for our dollars. But then from an ethical standpoint, we need to put in a referral mechanism. So CMS uses different acronyms, and they use HRSN, which is health-related social needs. This includes the measures of food insecurity, housing instability, transportation needs, utility difficulties, and interpersonal safety, which is your domestic violence. So any of these health-related social needs can lead to a negative health outcome. So in addition to this, each hospital will need to attest to the commitment to health equity. That sounds like, oh, that's easy that you're just saying yes to that. But there's actually 5 domains to this attestation. Each domain has about 3 to 4 elements. Each domain is worth 1 point. You have to get all 3 to 4 elements to get that 1 point, so a total of 5 points. You really have to work with your operational leaders to provide a framework about that book of evidence, right? And that's one of the things I'm working with our health system with. The social determinants of health. These are the social drivers of health. These are the social risk. These are the economic and the social conditions that influence individuals and groups, the differences in their health status. They are conditions where people are born, where they live, where they work, where they learn, where they play, and where they age. It makes up both who the people are, so that's your age and gender and genetics, and also what people do, so within their health behaviors and their lifestyles. So this is a wonderful framework to kind of show you the factors that influence both our length and our quality of life. This is the county health rankings model. It shows here the illustration how each factor impacts the individual and the community health. And within this model, we can see that there's a percentage of influence of each health factor with health behaviors that are attributed to the health outcomes. You can see that medical care is extremely important. We like to think it's the most important thing because we work in that health space, but you can see that medical care only is about 20% impacted the patient's health. It's all these other things. So you can see how the social and economic factors, they're the ones that have the drive, the hardest drive, right? So the education, the employment, income, family social support, and the community safety. We all know that things like our school system, the affordability of housing, a good job, a fair wage, safe neighborhoods, these all non-medical conditions, right? They're the ones, again, contributing to the highest part of health. And in the U.S., again, clinical care, what we actually do within hospitals only accounts for about 20%. So social determinants of our health are part of our patient's story. And for us to deliver holistic nursing, this means that we seek to learn the patient's whole story. How many of you have ever opened up a patient's chart, or maybe have even opened up your own chart within a patient portal, and what you see is the diagnoses, right? Like obesity or anxiety and depression, right? How many of you form biases when you look at those diagnoses, especially of obesity, anxiety, and depression, those with the mental health? Then you go look at their med rec, right? Then it adds on a whole nother layer. When the patient walks in, maybe they have a few tats on them, looking tattooed up, and maybe, they're looking at this picture. You've already formed what their story is, but you have not investigated what are those attributable causes or those challenges that this individual has walked through, where they live, what their socioeconomic status is, what are the barriers to their optimal health. We take for granted, think, someone doesn't have, look at them, they're poor, they don't have transportation, give them a bus. Have you ever imagined, maybe you should look at your team members who maybe are having to take a bus to work. You should have some real empathy for them. Think about your patients. You miss a bus, you're kind of screwed up, right? You're going to be tardy. What are those layers of stress, that oxidative stress that puts on? And so we really need to challenge ourselves and look at that whole patient story. So how do we as informaticists help collect this data that becomes integrated into a nurse's workflow where it's not just one more thing to do? It's integrated into understanding how the story unfolds, right? And we're going to give you kind of like a 1.0 lens. But just remember those things that are important. So for just an example, education. Did you know that just having a baccalaureate education is going to improve someone's life expectancy about 8 years compared to someone with just a high school diploma? Right? We already know that zip code matters, right? Where the person lives. But think about all the other layers and why this is important. And if what we do only counts for 20%, we have to help them achieve health equity by looking at all the other pieces of their story and then how to improve their health that way, right? So I'm going to turn it over to my colleague to be able to talk about how we address this problem.